Do you or a loved one suffer from asthma? If you do and you're under conventional medical care, you're probably taking one or both of a corticosteroid inhaler and a beta-adrenergic agonist inhaler, such as Flovent as the corticosteroid inhaler and Albuterol as the beta-agonist inhaler. If you're taking these, today I want to present a case to you and show you how taking these on a daily basis may be actually worsening your asthma and preventing you from ever healing from your asthma. How could that be? If you want to learn, watch the rest of the video. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Let's look at a case to help you understand how conventional asthma treatment may be making the asthma worse and may prevent you from ever healing from the asthma. Let's look at a case of an 8-year-old boy that I saw recently. He's an 8-year-old boy with asthma, and his mom reports that his asthma is worse in the winter and usually brought on by a viral infection. Now, this 8-year-old boy has had 4 cases of pneumonia in his life. He had multiple ear infections as an infant, and he's got stomach pains to go along with it. So let's get started on drawing up his case. We've got an 8-year-old boy, okay? 8-year-old boy with asthma. And that asthma is brought on by viral infections. So a virus infection usually triggers his asthma in the winter. As a treatment, the medical doctor's standard of care is a steroid and or a beta-adrenergic agonist inhaler. So this child is put on both. So he's given a steroid inhaler and a beta-adrenergic agonist inhaler. And typically, and he was told this, he's been told to take these daily. So take 2 pumps of Flovent twice a day and take 1 pump of the Albuterol. And what you want to learn today is that these impact the immune system, all right? And we're going to learn how. So we have the impact of the inhalers on immunity, and the impact on the immunity opens him back up for viral infection, which then opens him up for asthma. So you can see, you'll see in this 8-year-old boy's case today, that we have a vicious cycle or a positive feedback loop that could be keeping this child sick when it's unnecessary. And so we're going to approach this from a functional medicine paradigm to show you that if we seek to address the cause of the disease, we have a shot for cure, whereas if we're just addressing symptoms, there's no shot for cure. And you're going to see a study that shows you, and I'll throw it up here right now, that the corticosteroid and the beta-adrenergic agonist medications do not cure asthma. They just deal with symptoms. We want cure if we can get that, so let's go after it. Now let's look at the immune dysfunction that is leading to asthma in this child, stimulated by viral infection. Okay, so we want to understand the T cells, which are part of the adaptive immune response. You have an innate immune response, which you can think of as first responders. Okay, they're in all the tissues. If you have a wound or you have an infection, they're on the scene ready to go right away. There's a local police. Then in 3 to 5 days, your adaptive immune response shows up. Your adaptive immune response is the more highly skilled and highly trained part of the immune system, made up of your B cells, which make antibodies, and your T cells, which are the most highly trained assassins. So they show up 3 to 5 days later and really kick butt and take names. Well, have you ever been to a carnival? Do you remember the TiltaWhirl ride? You've got these arms going up and down and spinning in a circle, and at the same time at the end you're sitting in a chair that's spinning, right? So picture there's 7 arms of that TiltaWhirl going round and round. Well, from a T cell perspective, we know scientifically that right now in 2022, there are 7 different types of T cells, and they're called T helper subsets. So we would say Th1 or T helper type 1, T helper type 2, T helper type 9, and on, okay? And understanding the balance or lack of balance between the different T cell subsets helps us understand how a person's immune system has gone awry and how we can push back to fix it. So the TiltaWhirl metaphor is a little too complicated, so let's narrow it down and make it more easy to understand for this video by using a seesaw, okay? So if we draw the seesaw here, or teeter-totter, however you know, whatever you call it based on where you grew up, we have a teeter-totter. And on this side here, we're going to put T helper type 1 cells, or Th1 cells. Th1 cells are the main antiviral response from the T cell perspective, okay, or from the CD4 subset. And so we want robust T cell defenses because they're antiviral and anti-cancer surveillance for us. And when we're looking at a CBC, which is the standard blood work that your medical doctor does, these are represented by monocytes on the CBC. Okay, so if we're wanting to fight a virus, we want to have robust Th1 response. On the other side of the seesaw, we'll put the Th2 response. Okay, Th2. Now, viruses infect your cells, so that leads to an intracellular infection, an infection inside your cells. So when you have a virus, the Th1 cells will come, and so if this cell is, if my fist is your cell and there's a virus inside that cell, when your immune system recognizes it, ultimately the Th1 cells will come and eat that cell. Okay, that ate the John cell, so I lost one of my own cells, but we also killed the virus that was inside it, so it was worth it, right? We killed the infection and cleared it. Good. What if you have an infection that's too big for your cells, like a parasite, or yeast, or mold, or certain bacteria, okay? If they're too big to eat, that Th1 response is not effective against it. So if you have an infection outside your cells in a hollow space in your body, like the gut, the lungs, the sinuses, the bladder, okay, that requires a different response, and that response is going to be a Th2 response. So Th2 occurs in hollow organs, usually where there's mucus. Okay, so gut, lung, sinus, bladder. In this case, lungs, we're talking about asthma. And the Th2 response, most of you are familiar with, whether you've experienced it or know someone with it, because this is the main allergy response. If you have allergies or you've ever had an allergic reaction, that's a Th2 response. And so the cells on your CBC that help us understand a Th2 response are called eosinophils and basophils. And then from the aspect of asthma and histamine responses, mast cells are also involved here. So when we had a viral infection, the Th1 cells could come and eat that cell. When we have an extracellular infection that's too big to eat, we have to recruit different cells, and these cells can't eat that infection. Instead, they're using histamine bombs or histamine grenades to throw at that parasite or that yeast or that worm. Okay, they're using different types of weapons. But if that histamine response gets too large, now you have an allergy response and you're on the spectrum from hives to EpiPen or asthma attack or whatever we're talking about. Okay, so in a healthy, in an asthma situation, this is typically what we see. We see the Th2 side very high. Okay, the Th2 side is ramped up. We've got lots of histamine response. We've got airway inflammation, which leads to difficulty breathing. Okay, so the doctors give you the inhalers. The steroid helps put out the inflammation. It's anti-inflammatory. The beta-adrenergic agonist helps dilate the vascular smooth muscles so you can breathe easier. All right, which are good, life-saving things. We want that in an acute situation. So that helps you survive the acute asthma attack. But what those things are doing are promoting a Th2 response, because corticosteroids, cortisol, stress, okay, anything that's going to increase your corticosteroid level is a Th2 promoter, okay? And beta adrenergic agonists contribute to a Th2 bias as well. Well, if you went up in the air on the seesaw, where did I go? I'm on the other end. Where did I go? Right? I had to go down. Okay? So when we have a Th2 response happening, if we have asthma or we have a parasite, we have something that a Th2 response is appropriate for, it's appropriate for it to go up and this to go down, because these aren't going to help during that situation. But if we clear the parasite or finish the response to the allergy or the asthma, we don't want to stay up there, right? Because if we stay inflamed in an allergic standpoint, we're risking EpiPen or further asthmatic exacerbation or other symptoms depending on where in the body it's happening. So once we've cleared the issue, we want to come back to balance. Why? Well, because if you're high here, you're low here. So being high over here reciprocally inhibits this. Well, if we inhibit our antiviral response, what's that do? That increases our risk of a viral infection. And if we're infected with a virus, that drives our asthma and starts us back on that loop. So the immune system, and this is called your immune phenotype or the immune phenotype balance, your seesaw, is very important to understand in asthma or autoimmune disease or anything we're talking about from a chronic disease, chronic inflammatory issue. And I talk about this further in my Amazon best-selling book, The Autoimmune Answer. So if you want to learn more about the other T-cell subsets and how it applies to chronic inflammation and autoimmune disease, check out that book. So in this case, we want to understand that seesaw and we want to push down the Th2 response and raise the Th1 so that, listen, if we have a better antiviral defense, we can stop the virus. Stopping the virus would prevent the asthma. Stopping the asthma would mean we don't need the medications, and not needing the medications would mean we're not skewing this relationship. Okay, so let's dive into the research to help understand how these medications skew the relationship of the immune system. All right, if you're still watching, we've come a long way, and I applaud you for watching because we're laying out physiology for you. The key to solving chronic and complex issues is understanding the physiology, because then we know where we need to push back. So I want you to understand how the treatment, the conventional medical treatment for asthma, the inhalers, could hardwire the immune response that causes asthma, right? So then the supposed treatment becomes an exacerbating factor. That's not good, right? We don't want to have asthma attacks. So if your goal is to not have an asthma attack, potentially taking an inhaler every single day as a preventative measure is not a good strategy. And we're going to see why in a moment. But if you take it every day, and this research is true, then you could be hardwiring your immune system toward this way, increasing your risk of asthma, and at the same time, through the reciprocal inhibition of Th1 on Th2, increasing your risk of viral infection. In the case of this 8-year-old, the viral infections usually trigger the asthma attack, so that's a double whammy for this kid. So let's throw a study up here from the American Journal of Respiratory and Critical Care Medicine, and it's entitled Interactions Between Corticosteroids and Beta Adrenergic Agonists in Asthma Disease Induction, Progression, and Exacerbation. Now, this first paragraph here, this is the first paragraph from the study, and I'll read it to you. It says, the therapeutic benefits and safety of inhaled beta adrenergic agonists and glucocorticosteroids place these drugs as the cornerstones of contemporary asthma therapy. Okay, so right there in the paper we know that. If you have asthma, the cornerstone therapy you're going to get from conventional medicine is a steroid inhaler and a beta adrenergic agonist inhaler. Those are the cornerstones. Look at that next sentence though, underlined in red. Neither drug class can cure asthma, alone or in combination. Okay, so right there they're saying the treatment for asthma that you're getting from conventional medicine cannot cure your asthma. The best it can do is suppress symptoms, and really the best use of it is during acute attack to be a life-saving measure. But then, if we can't cure asthma with the cornerstone treatments that are given for it, how can we? Can we at all? And if so, how can we? The answer is yes, we can. And how can we? The answer is, in each individual case, figure out the specific drivers involved and address those, okay? So we have medications that are cornerstone of therapy. They're known to not cure it. Neither of them will, whether we take them one at a time or together. So the best we can do is suppress symptoms. Therefore, if you want cure, we have to go outside the medication and find causes and underlying causes to the causes and address those. So if we go further down in the study, if you look at the blue area here, it says, the ability of corticosteroids to effectively suppress interleukin-12 production has been widely overlooked. Okay, what the heck is interleukin-12? I go through this in the introduction of my book, and I can throw this image up here from my book. But this is a picture of how your T cells develop in your immune system. And you can see you have a naive T cell, which is an immature baby, metaphorically, and it can grow up and mature into one of multiple professions. Say Th1 is a doctor, Th2 is a lawyer, Th9 is a carpenter, and on, okay? And what you can see in the image is on the arrows that would mature that immature baby to a Th1 cell is some letters and numbers. And on the arrow to the Th1 is interleukin-12. Okay, so interleukin-12, IL-12, excuse me, is needed to promote Th1 cells. Okay, if we don't get IL-12, we will not get Th1 cells. We will not have effective antiviral and anti-cancer defense. Well, let's read that line of the study again. The ability of corticosteroids to effectively suppress interleukin-12 production has been widely overlooked. We do not want to overlook the ability of corticosteroids to suppress interleukin-12, because suppressing interleukin-12 is suppressing our antiviral defenses, and in the case of this 8-year-old boy, suppressing antiviral defenses triggers his asthma. So if the treatment for the asthma is promoting asthma, in his individual case, by weakening his antiviral defenses, what good is that treatment, right? So that's one way that the treatment is potentially not good for this kid, or not good to do every single day, okay? Because daily suppression of this is daily promotion of that. And daily promotion of that increases risk of both that and that, okay? And hardwiring your immune system that way promotes issues in gut, lung, sinus, and bladder. Okay, he's already grown up with repeated ear infections, 4 pneumonias, asthma, and now at 8 years old in the last 3 months is having chronic stomach pain. So we're collecting hollow organs, and hollow organ immune response is Th2. We don't want to collect hollow organ conditions, okay? Next sentence. These observations are important because they raise the possibility that early intervention with current asthma therapy of beta agonist and steroids, while it will effectively control overt symptoms and inflammation, may hardwire immune deviation towards a Th2 response. Okay, so right there on paper, the American Journal of Respiratory and Critical Care Medicine says taking the beta agonist and corticosteroids may hardwire us in the exact immune response that causes the asthma and inhibits antiviral defenses, which in this child is important because viruses tend to trigger this child's asthma. So is daily Flovent a good strategy for this child? Based on this research, this literature, it does not appear to be, if our goal is to have an optimal immune response in prevention of viral infections and prevention of asthma. So moving on in the yellow there, it says, in this context, it is important that as Th2 immunity evolves, signal transduction from IL-12 and interferon gamma receptors are progressively extinguished. Okay, so again, as we push this up, this is pushed down. It's a seesaw. One side goes up, the other comes down. We're reciprocally inhibiting that. So knowing what we know, which is established in the literature about how these drugs impact the immune system, taking them daily in the case of this 8-year-old boy is probably not the best idea if our goal is cure, not suppression and prevention of symptoms, right? And even if your goal is only suppression of symptoms, ultimately it's going to lead to more asthma because of this imbalance, this seesaw imbalance, which will cause viral infection, which causes more asthma, okay? So I hope this makes light bulbs explode in your head for you, especially if you have asthma and especially if you're someone who's on daily medication with one or both of these. I'm not telling you to get off them because I don't know you or your case, but this is information to know and maybe speak to your provider about to help understand, hey, what are the goals in my case? If the goal in your case is optimal immune function, optimal physiology and quality of life overall, and healing, then taking a drug that it says explicitly this will not cure it is not going to help you get to that goal. This can be a good rescue strategy to keep you alive and help you deal with flares and exacerbations, which buys you time to address the real causes over time. And as you address those, then you probably have less flares and exacerbations and less need for the medication. So this is how I approach asthma, or approach any case from a functional medicine paradigm, is to understand the individual in front of me, the factors involved in the case, the medications they're on, etc., and to look for the root causes rather than just suppress the symptoms, because finding the root cause is the key to healing and optimal quality of life. And functional medicine is root cause medicine. It's 21st century healthcare. And if this is something you want to pursue and incorporate into your life, reach out at functionalmedicinecharlotte.com.